Hello everyone, welcome to another Bug of the Month session. Today I will be sharing bone marrow aspiration smear slides of a 54-year-old male patient. He has been admitted to hospital with fever and altered state of consciousness. He also had jaundice and metabolic acidosis. And the preliminary diagnosis of the clinician was hemophagocytic syndrome. In overall, the smear slides were not really cellular, but we can see cellular elements belonging to all three lineages of hematopoietic cells. There is no evidence of infiltration, and actually the most important clue, which I didn't share with you in the beginning, that is the patient had a history of travel to Africa, which on our side raises a suspicion of a possible infection. So we start to scan the slides considering this, trying to find a bug actually. So we will take a closer look. This is actually a 40x magnification. We try to see these spindloid microorganisms. Well, typically they're called banana-shaped. So when we continue searching the slides, once we recognize one of them, we start to see there are many of these, like this one, and when we take a closer look in 100x, you can see the perfect shape of the gametocyte. Actually, this is a gametocyte of a Plasmodium falciparum, and we can see many of them are found if you look for them. And there are some other particles which look like artifacts, but we think some of them may be some different stages of this microorganism, like this one. This could be a schizoid. This is probably a small gametocyte again. Another banana-shaped gametocyte here. This is also a gametocyte. So if you truly scan the slide, you can find different stages of this microorganism. And this Plasmodium variant is not really frequent in our country, so this is a really interesting case for us. But if we didn't have this history, if we didn't have the suspicion, if we didn't look for the microorganism, we may not be able to find it. So it is important to know the history and to really search for this microorganism. Malaria, and especially this variant caused by this falciparum, is not really frequent in our daily practice. So the history is really important for us. And I will show you just quickly another patient which too has 8 years in between. This patient was previously diagnosed as malaria before it is admitted to our hospital. This slide is much more cellular, but the most striking feature in these slides were actually these particles here, and the hemophagocytosis is much more prominent in this patient, but it is harder to find the gametocytes in this slide. We found them, but which were much more fewer in number. But these pigments and the hemophagocytosis are actually clues for this microorganism again. So even if we didn't know the history of the patient, we may have searched just because of these pigments, the clinical history and hemophagocytosis, which we see frequently in these slides again. So this was it for this month. I hope you enjoyed the case. Bye.